New figures from the UK Health Security Agency have revealed a worrying rise in deaths linked to so-called superbugs, which are bacteria that no longer respond to frontline antibiotics. Health experts say this trend highlights the growing threat of antimicrobial resistance. They say that it is one of the world's most serious public health challenges. When antibiotics are overused or misused, bacteria can evolve to survive treatment. Over time, these superbugs become harder and sometimes impossible to treat, leading to longer illnesses and more deaths. The report also found a large increase in private prescriptions for antibiotics in 2024. 22% of all antibiotic prescriptions were dispensed privately, which is more than double the figure from 5 years earlier. This surge is partly linked to the government's Pharmacy First scheme, which allows pharmacists to prescribe antibiotics for 7 common conditions like earache, sore throat, infected insect bites without patients needing to see a general physician. According to the latest data, 2,379 people in England died from antibiotic-resistant infections in 2024, and that is a 17% increase on the previous year. At the same time, the number of antibiotic-resistant infections rose sharply to more than 20,000 cases, averaging nearly 400 new cases every week. While the program was designed to ease pressure on doctors, experts are warning that easier access to antibiotics could accelerate resistance if not carefully managed. And in some cases, pharmacies prescribed antibiotics in 45% to 85% of consultations, depending on the illness. Global experts warn that antimicrobial resistance could cause up to 10 million deaths a year by 2050 if current trends continue. Let me just say that again, up to 10 million deaths a year by 2050 if the current trends hold. Although NHS antibiotic use has fallen since 2019, the overall use across both NHS and private care has actually increased by more than 10%, showing that there is still much work to do to curb the unnecessary prescribing. In short, fewer antibiotics are being given out by general physicians, but more are now coming from private and pharmacy channels. And that shift may be fueling the very resistance health officials are fighting to stop.
To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.